Welcome back, everyone. Dr. Naveen here from UPSC MEDICO. So, the first battle is done for Target 2025 UPSC CSE. So, many of you who have given this prelims will be inching towards the next step in the exam. For those who have safely cleared the cutoff, there won't be much worries for you, right? Because you know the cutoff and you are able to clear it and you can better utilize the coming 90 days. For those students who are doubtful about their cutoff and those who are not well prepared for 2025 will be having different plans altogether. So you're not clearing the cutoff, so let's better to think about the upcoming attempt, that is 2026 attempt. Now, for dilemmatic situation, for people who are in the borderline, it would be a tricky decision to make. So whether to prepare for the 26 attempt or 25 attempt, there's a lot of chaos and the majority of phone calls what I'm receiving for the past 24 hours are in this dilemmatic zone because nobody is sure about the keys, what kind of questions they ask, right? So for people who are safely clearing the cutoff, better to start focusing on 2025 exam. And for dilemmatic people also, it is very important to be also focusing on 2025 exam. I'll tell you the reason. No matter whether you clear this exam or not, your real competitors for the next year, that is 2026 exam, are always the toppers of 2025. They may be in the All India rank list, IPS, IRS officers, DANIX, Group B officers. They all again appear for the upcoming exam, the next exam. So they are your real competitors to beat. If you prepare well for this particular exam, not thinking too much about the possibility of clearing prelims or not thinking too much about whether you clear mains or not, it is always important to utilize these upcoming 3 months in the best way possible. You know the psychology of brain, how it works. If there is a deadline, we tend to focus a lot. If there is an actual date of the examination, you will be focusing on completion of the task in a fast paced manner. So let me put it in a simple words, like the amount of subject you're going to finish, the amount of knowledge you're going to gain in the next 3 months is far more than the next 12 months. Because if you're not thinking about the mains 2025 exam, your brain will be a bit relaxed. You want to take some time and you will go in a slow paced fashion. Then the anxiety levels will be very high when you actually appear for your target 2026 attempt. So what I believe is for those people who are in the borderline, give your best for 2025 attempt. If it doesn't turn out in a positive way, at least you're on par with your competitors who are going to give you a tough battle in the 2026 attempt. So with this stuff, let's look at this slide, what I'm gonna want you to focus. See, your exam is on August 2022. That means approximately 90 days are left from now. I'm recording this video on 26th May, that is within 24 hours of your prelims, believing that you're done and dusted with the keys part. Like different institutes might have released prelims key. Hopefully, you're clearing the cutoff. Now you'll be focusing on your mains examination, and this video is all about strategy for medical science optional UPSC CSE 2025. Now, 90 days for actual GS exam and approximately 97 days. Let's take 100 days for the medical science optional, because if you are new to this domain, you won't be writing the 5 days exam in a row. Okay, one weekend, that is on 22nd to 23rd to 24th, you will be writing your GS exams. Then after a while, maybe on day 30 and 31 August, the next weekend, Saturday and Sunday, you will be writing language exam and also medical science optional. Luckily, for an optional like medical sciences, which is full of static syllabus, you have been given a week to revise. That would be your final revision. Right. In this video, I'll talk about what to do in this 90 days time period. You're a little unlucky this year because we used to have at least 110 days between mains to optional exam. Sorry, prelims to mains exam. But this time around, because UPSC is trying to cut short the overall cycle of UPSC exam, so that's the reason you're only getting 90 days of time. Now there is no time to think. So my first and foremost take home from this video is don't wait for results. So you would be waiting for the prelims results and you would be thinking that I'll only start after getting the prelims result because that will cost you at least 2 to 3 weeks of time. Usually the results will be out in 15 days. So that means you will be wasting your 15 days of time and your competitor will be taking advantage of it. Even if you're on the borderline, just start preparing for this exam. No matter what happens, at least you're well prepared for the next attempt too, right? Now, this 90 days, now students are asking me how to divide the number of days, right? When you look at the number of days, you have 90 days. Look at the weightage of the exam. That means this exam has, let's say, 2000 marks. Now, 500 marks for optional and 1500 marks for GS, approximate. Now, when you have 1500 marks for GS, right, you have to dedicate 70% of the time. That means 30% time for optional. That means 7 hours in a day for general studies and 3 hours in a day for optional if you want to continue this preparation for 100 days. But I don't want you to do it on a daily basis. For the first 60 days in the 90-day cycle, for the first 60 days, finish off optional. Give more weightage to optional because once you finish your optional, in the next 30 days before your GS exam, your brain should be full of current affair related stuff, right? Because you're giving an acute exam after 30 days and you need that acute knowledge to master or to perform well in that exam. So in the next 60 days, I want you to focus mainly or majorly or majority of your time or 30% of your learning time overall should go to medical science optional. Now you have 60 days of time to do optional. Now, if you're starting just now, if you're just passed out intern from MBBS, and luckily or unluckily you're clearing the upcoming prelims, and you have to give a shot at your mains. So in that scenario, in these 60 days, you might feel like learning a lot of stuff. Don't focus on learning new things. Whatever you have done so far, okay, just revise them. But on top of that, the most, let's say, the number one success formula or number one success mantra for UPSC exam is doing a lot of practice. That means answer writing. This is a game of answer writing. If you are a batsman in cricket, you have to practice batting. There's no point of understanding the ground conditions. There's no point of understanding the bowler's weakness and strengths. First, you have to get onto the field and practice. Okay, if you practice, no matter whatever is the pitch condition is, no matter whoever is the bowler, if your basics are right, if your practice is good, that too just before a match, there are more chances of you performing well. That's what I say. Practice makes you perfect. So this is the time to do a lot of answer writing. And those who have done good amount of answer writing, my 6 years of experience, I'm telling you, the more you write, the more marks you get. The only direct relation are directly proportional. The more you do answer writing, the more marks you get. See, our the psychology is that the nature of our brain is that it wants to relax. It wants to stay in the comfort zone, right? I could see that many students now they enroll into combo course, plan A, B, C, video courses and all. They'll enjoy the videos. They'll watch the videos in 2x, 3x for quicker revision. They'll go through the notes. But they'll keep the answer writing part, which is the toughest part of all in this exam, to the last because they don't want to get out of the comfort zone. So this is an answer writing exam. Unless you put your pen on the paper, you will not understand the demand of the exam. You are not actually ready for this exam unless you do answer writing practice. So for that reason, I would recommend you to put practice as a priority. The more you write, the more answers you get. And in the practice also, you have to have a strict timetable. That's I'm going to finish n number of tests in this time period. So let me have a fixed timetable and write according to that. And many of you might be part of UPSC Medical courses, right? If you're part of combo course or test series for 25-26, recently we have launched a target 2025 test series. If you're part of that also, try to for combo course and regular test series, those are flexible test series. I always recommend students to have a personalized schedule there. But for target 2025, the latest test series with 3 months validity, I have given a fixed schedule. Now have a fixed schedule, and this is the time where you do a lot of GTs and sectional tests rather than subject-wise tests. There is no time to focus on an individual subject. You have to learn medical science now in a holistic fashion. Like Pick anatomy, biochemistry, physiology. Read all the important topics, revise them. If you have bookmarked videos in the video course, just jolt them, like watch them in a 2x fashion, finish them off, come back and give a sectional test instead of a subject-wise test. Sectional test also gives you practice to choose or pick a particular question, because in the final exam you will see a mix of different subjects asked in a single set of question, right? I think you have come so far. I believe that you understand the pattern of the examination, the type of questions being asked, so I don't want to waste time there. What I'm trying to tell you is that instead of practicing in a subject wise fashion, this 3 months or 90 days is the time period wherein you actually practice in a sectional fashion and also grant tests. So grant tests are also given, always given a priority over sectional tests. Subject wise tests, least priority. Don't do subject wise tests now. This is not the time to master subjects, right? If you practice sectional tests, there would be some subjects which are your strengths, like pathology, pharmacology could be your strengths. Maybe microbiology you're weak, maybe FMT you're weak. So you can focus more on path and form to get over the line, right? So if you practice in a, if you can simulate the real time environment, the real exam environment which comes with GTs, full and test, you will perform well. For example, last year the topper, medical science optional topper in 2024, Dr. Nishant, I think he's few among many who were able to actually write full and test during this time period. So you have proof that topper of medical science was also following the same thing. That is, he was writing full length test at this point of time. So that's the reason this Target 2025 test series, which was truly this recently launched. Now we have a lot of GTs included in it and also sectional tests with 250 marks. 3 hour exams, real simulation. Even in combo course, if you're part of combo course also, you have two full length tests with four individual tests. Like each full length test has paper one and paper two, right? So do sectional test and full length test now. That should be your strategy. Now, when you revise, if you're part of my video course or if you want to enroll into a video course for 2025, first and foremost, pick high yield topics. I will give you the list of 110 high yield topics which are frequently repeated. I will attach the link along with this video. Go through that list, open that particular video. If you are a video watching guy, quickly finish off watching video in a 2x fashion. Our notes and videos are in accordance with each other. Just underline the notes or quickly revise the notes. Finish the topic and move on to the next topic. So likewise, I would like you to finish most of the high yield topics, which are previous year questions, because 80% of the times this exam is a repeat exam. Now, uh, this much is enough to score 250, 260, but you need to do a little extra work because you're writing kind of toughest exam on this planet, right? Just um, quickly going through PYQs may not always sail you through the race, but a little extra effort should be put into lit gray zone topics. I will give you the list of gray zone topics, and also 20% of the questions I could see are coming from unasked version. Maybe the overall ratio or percentage is less, but these questions are coming in mandatory questions part, question number 1 and question number 5. Now, if you don't understand the pattern of the examination, let me tell you this UPSC Medical Science optional final exam has, each paper has 8 questions. 8 questions. This 1 and 5 questions are mandatory. You should attempt them. Yes, overall you have to attempt 5 out of 8 questions, but it is not simple. You should attempt 1 and 5. Remaining 3 in section A, you can attempt any two. Remaining 3 in section B, you can attempt any two, like any one. So the fifth question should be, let me write it again. 1, 2, 3, 4, section A, section B, 5, 6, 7, 8. Now this should be must. 1 and 5 are must. Now you have to attend 5 out of 8 questions. Now you can attempt any of the 2, 3, 4. You can attempt any of the 6, 7, 5. Now you are left with one more question to choose. You can choose it either from 3, 4 or 7, 8. Or like only 1 and 5 are mandatory. You can even skip 2, choose 3, and then from 4 and 7, 8, you can choose 1. So you should understand the pattern of the examination. And this mandatory part, question 1 and 5, I could see a little bit of unasked version questions coming up. Okay. So You have to be very careful about this. The pattern or the importance first should be given to 80%. That is, you will have PYTs and high yield topics. Now, next is unasked questions. That is 20%. There is a gray zone in between area. Though they are PYTs, every year they're asking a different question. So it is neither an unasked version nor a high yield version or a dictum topic, right? These are gray zone topics. I'll give you the list of those topics also. Now, if you're part of our courses like combo course and test series, there is topper copies available for reference. The only way you can actually understand the mindset of an examiner is looking at the topper copies, because I think examiners likes the topper copies, right? Even in GS, this is the pattern you follow. You browse through the topper copies, you learn from that. So I have uploaded almost 50 or 60 topper copies in last 5 years, which are part of the course. You can pick and choose few topper copies, and if they match with your answer writing style, you can learn from them, right? So refer to topper copies for sure. And also there is a 2 hour video in the course curriculum of test series and combo course, which is mainly on tips for answer writing. So this is my 6 years of experience. What are all the things I would be looking at as an evaluator when I actually correct your papers? What should be their introduction? What should be the conclusion? What is that the pattern or the presentation style I will be expecting? How the images should be, right? So, and how the clinical approach should be for any clinical question. What should be the treatment strategy? How to draw an algorithmic approach, that is the flow chart. So everything I have discussed in a 2 hour video, which is part of either our test series or a combo course. Before starting your test series or answer writing practice, please go through the tips for answer writing video, which is there in your curriculum, course curriculum. That will give you, let me promise you, if you understand the uh, essence of that video, if you watch it once or twice, you will get extra 20 marks. I can promise you that, because there's a lot of experience which has put into that video. Now refer to topper copies and watch these tips. This itself will give you that plus 30. Okay, if you're scoring 250, if you understand these things, I think you're safe about 280, which is a safer margin. Now, many of us we are struggling to keep track of PSM updates. Luckily, last year there were not much questions on update related PSM, but it is always important to have or keep track of PSM updates. In the recent course, in the video course, I have uploaded recent changes in PSM 2025 video, detailed video of 1.5 hours about what are all the changes happened in PSM up to date 2025, and the same notes has been updated. So just keep track of PSM updates. And very importantly, if you open final examination question paper of medical science, and if you can see, it is clearly mentioned that draw images wherever necessary. You can use color pencils. You have to, that means examiner is indirectly telling you, I'll be impressed if you draw images. That too, I'll be more impressed if you draw more and more images wherever relevant. And I will be even more impressed if you use color pencil. He's giving you a clue. And I can observe that last few toppers, few year toppers, though their content is lagging, they were always ready with images. You take Dr. Anjali Garg. For each question, she has drawn an image. And she scored around 287, the topper of that particular year. That means practice images. Take some time. Like, for example, you have 60 days of time to focus on medical science. Daily 5 images. You have notes of UPSC MEDICO open. There are around overall 600 or 500 images in all the subjects, right? Wherever possible. I think I would be exaggerating the number, but fewer less than that. But you would see all high yield images part of our notes. Just go through the image. Just draw a sketch, rough sketch of that image and practice it. So even if you practice daily 5 images into for 60 days, you would be finishing almost 300 images. Okay, images are vital pillars for medical science optional exam. And one area where many of the beginners fail is they fail to draw images in the exam. Okay, you have to draw images wherever necessary, and it is mentioned in the curriculum. So these are the 8 important points that you should keep in mind. And about number of hours students are asking, if you're doing 10 hours a day, at least spend 3 hours on optional. But if you're only doing for the first 3 days elaborative or more comprehensive way of medical science, then 5 days per subject is enough, because you have 12 subjects for 16 days, and each day you can allot 5 hours. So overall, for one section, that is anatomy, physiology, biochemistry, you can spend up to 15 days. In parallel, for section B subjects also spend 15 days. But because biochemistry is a minor subject, because microbiology is a minor subject, because dermatology is minor subject, don't ignore them. They are high yield subjects. They have, like, for example, if you have 250-mark paper, if 70 marks is anatomy, 70 marks is biochemistry, 70 marks is almost uh, like approximately 70 marks is physiology. That means though the subjects are tiny, equal weightage is given to each subject. So that's the reason you have to do them elaborately. You have to spend so much of time on biochemistry also to master it. Just don't run away, because the weightage is similar to each subject, and give due diligence and respect to each subject and allot equal time to each subject. Right? Now, don't spend too much of time on general surgery. There are so many topics, but weightage is less. Right? For lengthy subjects, also cut short. For anatomy, also, you can't spend hours and hours because there are n number of topics for anatomy. So use your time wisely. Give equal importance and timing for each subject. There are 12 subjects. Even if you spend 5 days per subject, you can finish this in 60 days. Right? So from images point of view, focus mainly on anatomy, pathology images, and microbiology images. Now for combo course students, its test series is a part of it. The test series, you have to quickly revise notes, watch bookmarked videos now. Now this is not the time to finish 220 hours of videos. You can do it if you want, but I still recommend not to do 220 hours, but at least do 90 hours of videos which are high yield. So pick revision topic, go to the course curriculum, open that subject, watch out the video, underline the notes, finish off the subject, and go and give a test. I still recommend not to give a subject-wise test at this point of time. Only focus on sectional tests, followed by full length tests. Now, I'm not giving a fixed schedule for combo course students, because most of the combo course students are not immediate target students. They will be targeting 2026 or 2027. If you have enrolled in 2023, 2024 also, just try to focus on full length tests and sectional tester now, and only watch high yield videos from the topic list which I'm going to give. Don't try to complete everything in this 3 months, because that will put a lot of burden on video watching, and that will kill time, so that you're not going to practice at the end. So for video course students who doesn't have test series access, this is the time to enroll into the test series. And we have an exclusive test series for Target 2025. I will upload that link along with the description. Okay, check it out. It is more fixed schedule test series with lengthy tests. Like you will be writing almost 8 full length tests. Okay, 4 grand tests and 4 sectional tests. It comes with a limited validity, that is 3 months validity. Now, for non-course subscribers, if you're not part of UPSC Medico, I do recommend to take up a video course which is 3 months, that is Plan A, plus you have to enroll the 2025 test series. This is the best combination I could offer. For those students who are very serious about 2025, that you're going to, this could be your last attempt, you're not thinking about anything else. But if you're just on borderline and if you want extended access, better to opt for combo course, because combo course will cover even 2026, 27 attempt also, because it comes with 2 years of validity. People who have just started, they're not worried about 2025 attempt at all. Just for the sake of experience, they're giving it, and they lack foundational knowledge. I think foundation course, the third course which is available, is the best way to go. So you have platter of courses, buffet of courses available with UPSC Medico, catering to individual needs. I will help you in making a personalized decision. You can always get back to me for choosing the right course. Now, quickly move on to old students. Like you have like combo course student expired, test series you have finished it, expired. There are few students who are also part of DAWP programs. You have practiced well, but now you don't have any access to it. And the major chunk of competitors are all India rankers. Like even rank number 153 going to write this exam, he is your competitor too. So for all India rankers who have already practiced, see, I have a suggestion for you people. Okay, what you have to do now is, you might feel that I have done enough practice. You might feel that I have written enough tests. You might feel that I have revised a lot. You might feel that I'm already an All India ranker, but don't carry this confidence for last 90 days. Start from zero again, because acute practice matters. That means you have to write now. Irrespective or in spite of what you have done in the past, it is not going to count. People who actually write during this 90 days are going to outperform people who haven't done so far. That's why whenever I sell a combo course, I tell my students only write subject wise tests while you're learning a subject. Keep your sectional tests and full length tests for this 90-day period, because this is the time you have to write these tests and practice. Practice makes you perfect, and this practice should be just before your match. This practice should be just before 90 days of your exam. So for all and all India rankers, we're going to repeat this exam. For all combo course students, expired student, test series students, re-enroll into any of the test series of your choice. My recommendation is always a target test series 2025 for 3 months access. I'll share the link, just go through it. But don't forget or don't ignore the answer writing practice. Please, please, please do write even if you have practiced enough in the past, because that's going to make a lot of difference in the final stuff. Now, high yield topics, I'll give you the list. There is an article in UPSC Medico. I will attach this in the description link. Now, gray zone topics, I'll just briefly discuss what are the gray zone topics in the next slide. Now, 30% of the questions are unasked, 20% of the questions. So, what topics which were not repeated, which can be expected? One is SDGs, health related. Don't worry, in this link only, in the article section link, I'll be adding these topics. You don't have to take a screenshot or make a list of it. Don't write it. I will be giving a link. Therein, everything is there. Now, vitiligo can be repeated, labor management can be repeated, endoscopy, stones of ureter bladder. Most of the times, renal stones is there in the syllabus, but they're not asking questions on ureter and bladder. Cleft lip and cleft palate from general surgery, coarctation of aorta, neonatal resuscitation, 2D echo, antidiuretics, anti-Kala-Azar medication, antiviral medication, anti-parasitic medication, coagulation disorders, Japanese encephalitis, giardia, osteomyelitis, tissue repair, optic and auditory pathway, gonads, development of gut, ventricles of brain and CSF, and vitamin. Osteomyelitis is repeated. Now, recently they have asked a question on what is the topic? Yes, antiviral, right? No, 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 not antiviral. Yes, labor management recently asked. So these are the left out topics which can be asked. If you're very confident about PYTs, then don't forget to do this. Anyway, in the test series, I'm giving equal importance to them. Like you will be, if you're part of the test series, subconsciously and involuntarily, you are going to cover these topics in one way or the other. Right? I have predicted some of the unasked topics last year also. We did revise them, and most of them, like for bone tumors, it was asked. Right? So there are 9 unasked topics which were used up. Now we are only left with hardly what how many we have? Hardly 20 unasked topics are left so far in the syllabus, right? Now, what are the gray zone topics? As I said, any cranial nerve can be asked, any vitamin can be asked, any mineral can be asked, any glomerulonephritis type can be asked, any immunoglobulin can be asked, any joint from hip joint, shoulder joint can be asked, any median nerve, radial nerve, ulnar nerve can be asked, any antibiotic including cephalosporins, penicillins, vancomycin can be asked, any injury. Injuries topic of forensic medicine is so exhaustive. I recommend not to learn this topic at all, because they can ask any head injury or bullet injury or sharp knife injury. They're asking like out of nowhere any injury is coming into the question. Any poison, like 11 to 12 poisons are already a repeat. So better to focus on only on the PYTs on this topic. So why I'm highlighting this, only and only focus on PYTs here, because it is not possible to learn these topics in greater detail for now. Better to focus on PYTs and hope that the same question might repeat. For example, if you want to take only one now, only learn about facial now, because there is a paucity of time. Now you can't learn cranial now 1 to 12. Similarly, vitamins most commonly asked are always vitamin B12, folic acid, vitamin C, and vitamin A. These are the vitamins so far asked. Just focus on PYQs. Minerals also they're asking iron mainly, iodine, because it is related to thyroid and all. Apart from that, don't worry about it. Look, fluorine was asked, but it was long back. Similarly, renal pathology, most of the times they're asking about membranous glomerulopathy. Immunoglobulin also, mostly they're asking about IgA. Joints, you have to learn everything, because each year, each joint is getting repeated. Hip joint, shoulder joint, and knee joint, right? Peripheral nerve injuries, yes, you have to learn 3 nerves only: median nerve, radial nerve, ulnar nerve. Antibiotics, just focus on penicillin and related antibiotics. You can't learn all 24 antibiotics, right? Injuries also, just focus on entry and exit wound, antemortem and postmortem wounds. Poisonings also, there are 11 poisons which were there in our notes, UPSC Medical and discussion. And commonly repeated poisonings are paracetamol poisoning and OP poisoning. And snake bite, which was recently asked. Maybe scorpion bite can be repeated. So likewise, you have to be picky about this gray zone areas. Malabsorption syndrome, celiac disease was commonly asked, but there are n number of malabsorption syndromes which can be asked. Complications of cirrhosis of liver, there are many. You have portal hypertension, you have spontaneous bacterial peritonitis, you have hepatic encephalopathy. you have ascites, anything can be asked as a part of hepatorenal syndrome, hepatopulmonary syndrome. Diuretics and antidiuretics can be asked. Complications of diabetes mellitus, yes, they're asking about diabetes ketoacidosis, they're asking about diabetic nephropathy, they're asking about diabetic foot, they're also asking about diabetic autonomous, and that is diabetic neuropathy can be a potential question, diabetic retinopathy can be a potential question. So anything related to complications of diabetes comes in the gray zone. But because you have a time paucity, let's focus only on the diabetic ketoacidosis for now, because which is a frequent repeat. So in gray zone areas, always and always stick to PYT. So likewise, IMNCA was a bouncer. Recently, a 20 mark question coming on to less than 2 months of old. How do you manage a serious bacterial infection? That was out of box question. In meningitis also, they can ask any meningitis question. Can be meningococcal meningitis, can be cryptococcal meningitis, can be a viral herpes simplex encephalitis or AIDS related stuff. So they can ask anything related to meningitis and encephalitis. So likewise, these are the gray zone topics wherein you have to be very focused on the PYTs. Now there is subtle changes to terminology that you should keep in mind. That is, now we don't have Millennium Development Goals in the syllabus. We have Sustainable Development Goals. We don't have dysfunctional uterine bleeding. Now we call it as abnormal uterine bleeding. And there is a palm coin classification which was recently asked. We don't have ARF. Now we call it as acute kidney injury. We don't call chronic renal failure. We call it as CKD. Now leukorrhea is not there. Any STD is now like it's a gray zone topic again. They can ask any leukorrhea, any STD, even pelvic inflammatory disease also they're asking. Now primary biliary cirrhosis is now primary biliary cholangitis, new terminology. Benign breast disorders, now we call it as ANDI. So this is subtle changes to terminology of the syllabus. Just keep in mind, if they ask ARF question also, write down that now we call it as AKI. The terminology has been changed. It will work like a very good introduction to your answers. Now, as I said, there is a target test series available, a regular test series, which consists of PYTs and gray zones, predictive topics and unasked topics at a ratio of 55%, 30%, and 15%. I think this is the best way for you to practice. So practice makes you perfect. Always available for further assistance. Dr. Naveen here from UPSC Medico. As I have promised you for last 6 years, I am here to stay and here to guide you to pass this stage and get into the next stage, that is the personality test. So this is my number 8978444188. All the essential links, that is topics list, courses list, and also the contact details, I will provide it in the description of this video. And all the best for the upcoming mains. And these 90 days, you have to give your 100%. You will be tested in a lot of aspects. You will be tested with handwriting speed, you will be tested with time management, you will be tested with your anxiety coping skills. And for a lot of students, there will be relapses of migraines, there will be recurrences of, or there will be exaggeration of symptoms of like headache. If there is an autoimmune disease, it will also relapse. So maintain calm, maintain consistency, start early so that you will not fall into that anxiety. Don't wait till the results. Okay, so make use of 90 days in best possible way. If you need assistance or help or motivation, Dr. Naveen is always there as your friend, as your senior to guide you further. All the best for the upcoming mains 2025.